everyone. I am thrilled to bring to you Dr. Mallory Salentine. We met because we have awesome dogs and we like to post them on Instagram, which you can find out a lot about what Dr. Salentine talks about and what we'll be discussing here on her Instagram. I love a lot of the messages she shares. So we'll go ahead and put that Instagram link in the description. But I will now introduce you to this wonderful human that I have in front of us. She's a physician, a well-being expert, and a coach. And today we'll hear a little bit more about her story and talk about coaching in leadership. So love to hear more from you.
Thank you, Jillian. Thank you for having me here today. I love what you're doing with creating connections on this YouTube. I think it's so wonderful, and it's been so great to learn about other people and to meet you and to share our dog posts. So I love it. Thank you. So I am a pediatrician and I lead the physician wellbeing work for my organization. And the reason why I started that work was because I was not in a good place when I started in my role. So I had really been stressed within residency. I had experienced some traumatic events. And when I finished residency, I realized that I was just on autopilot. And when I started in my first role as a pediatrician, I was so stressed. I was up all night doing notes, thinking about my patients. And a colleague actually stopped me one night in January of my first year in my practice and said, you can't do this anymore. And I think I didn't realize how stressed I was until that moment when he said, like, you just can't do this anymore. And I think that was a huge awareness for me that I was really starting really in the middle of being burnt out from the work that I was doing. And so from that point on, I decided, yes, I can't do this anymore. So let's figure out ways to come back from this. And so I spent years really thinking about well-being and how I could come out of the stress that I was in. And my New Year's resolution in 2018 was to find joy in my work again. And so I spent that whole year really looking at what would bring me joy. And that first year, they actually at my organization had a mindfulness-based stress reduction course. And I hated anything that said mindfulness or meditation or any of those words were like trigger words for me. I had tried meditation in the past. I had tried, my mom actually had meditation tapes that she would like give to me, and I would try to sit there and listen to them, and I could not do it. And so this mindfulness-based stress reduction course came up, and I was like, well, this is my New Year's resolution. So I joined it. And I actually found that there's so many different ways that you can look at mindfulness, and you can look at well-being, and you can look at burnout, and you can look at stress. And that really opened my eyes to there was hope. And that same year, there was a well-being committee that started. And so I joined that, and then I chaired it. And now I have administrative work in that work. And I'm just seeing that there's really hope for coming out of burnout, coming out of that chronic stress. And I want to be able to provide that to the world.
That's amazing. And also, I was just thinking, mindfulness, it can become quite a trigger. My dog will bark. Let's be mindful of the fact that he's the reason why he co-hosts my YouTube. I'm being mindful of my stress level is like dog will bark and interrupt our YouTube discussion, but that's okay. I was thinking back to Dr. Nisa Kiashian. She came on and she created the book Practicing Stillness. And you have had ebbs and flows of mindfulness for the same reasons that you say. It becomes a trigger word often when people say it's the solution to everything. But when we become more mindful, when we're in a state of trauma or emotional pain, we become more aware of that discomfort. And that can be very uncomfortable. So, similar to hearing the word coaching, when we're burnt out, it took me a while to lean into coaching. And then I am a huge advocate for coaching, as we both have shared lived experiences of its value. And then also the term burnout becomes a trigger word because it's like, what does this even mean? And how do I even get myself out of it? Hi, Reese. This is how I got myself out of
Hi,
it.
Reese.
Cute little puppy. Isn't it true? Here's a recovering perfectionist moment. We can love the interruptions and appreciate that he's probably noticing, like, oh yeah, that was a stressful time, I'm sure, or he just wants some cuddles.
Mhm.
But not to be distracting, but the whole point is, when it comes to these words, would you help us to identify a little bit about when you were saying, you were noticing you were starting to get burnt out? What did that mean for you?
Yeah. So, burnout is a workplace, chronic workplace stress, right? That causes you to be exhausted. It causes you to have depersonalization. And really, I think the big key word there is chronic stress that's brought on due to workplace and organizational reasons. So there's lots of different things that can compound on that stress, that can be from home, that can be from your life. But the burnout specifically is in the workplace and what you're noticing when you're in the workplace. And for me, it was looking like constant work. And I just was like always working, and I was always thinking about work, and I was always thinking about my patients, and I was always worried about my patients, and I was just always feeling this like stress on my body that would never go away.
Mhm.
And I think that was really big for me. I was feeling exhausted. I mean, all of those kinds of things were happening for me. And I just thought it was normal. I mean, to be completely honest, like when you're in residency, you just work all the time, and you kind of put yourself second. Like work always comes first, your patients always come first, and you come second. And so depending on where you do your residency, you could be working basically all the time that you're not asleep. And I think I just thought that was normal. Like I just thought that was what we were supposed to do. And so then when I transitioned into my first job, it was like, but this is what I'm supposed to do. I'm always supposed to be working. I'm always supposed to be thinking about my patients. I'm always supposed to be calling them and making sure they followed up on this. I'm always supposed to be doing all of these different things. And I think I just did not have the awareness that this wasn't normal. And I think, when we talk about burnout, people don't like to use that word, but I think it's actually really important that we use the word, because if you can name it, you can tame it, right? If you can name what's happening for you, that's like a huge awareness that you can now go and treat and conquer. And I think that was something that was really important for me, was that I couldn't name it. I just thought this was normal. And once somebody stopped me and said, this isn't normal, you need to stop doing this, then it took time for me to search and say, what is happening? How is this not normal? And like, what I needed to give it a name, right? So that I could figure out how to move on from it. And so I think that was a really important step for me, was to name what was happening for me so that I could create solutions to get better.
I really resonate with everything you just said because in 2014 is when I developed deep depression and what was later named burnout. I thought I was alone because no one was talking about it. The inability to name what was happening and that feeling of being alone was what almost led me to not be here anymore. And so I
Mhm.
really appreciate the opportunity to have these open discussions because it took me until 5 years after I ended up leaving surgery and the Air Force to hear this is a huge problem. It
Mhm.
wasn't just me. And I feel like I still struggle with accepting that this is a really huge issue for a lot of different people. And then also you naming it and giving solutions for it are so important because we name
Mhm.
it, but if we don't have ways to change the system, which I love that that's the topic of our discussion today, because we often hear the term resiliency, which is great. We know we're very resilient. It's great to have tools. I was called very resilient when I was a
Mhm.
surgical resident. And I'm like, yes, we are very resilient. However, sometimes the system needs to change. And can
Mhm.
you tell me what you do and the role of coaching within leadership?
Yeah, I think it's actually really interesting that you bring up the term resilient and that you are resilient because you are. And it's proven, there's studies that healthcare workers are the most resilient people. And that is protective of burnout, but we have so much that's put on us that it's not enough. And I think that's really important is that we are resilient. Like we go into medicine because we are resilient, right? And I think that's just really important. Medicine selects for resilient people. So I just think, when we talk about resiliency and that word, um, I do think that it's important to keep working on that because I do think you can lose it over time. And one thing that I think is really interesting about resiliency is that we often think of it as something that we do in reaction to being knocked down, right? Like it's what helps us get back up. But actually, what I've learned through my training, through my work, through my coaching is that resiliency can actually be proactive. We can proactively work on our resiliency so that when we get knocked, we don't get knocked down, right? It's not something that we have to come back from. It's something that we can work through. And I think that was a really new perspective for me that I had not thought about previously because I had always thought of myself as resilient. And I'm a general pediatrician, and so preventative medicine is, my number one. And so when I started to think about resiliency as something I can do in a preventative way versus in a reactive way, that opened up a whole new perspective for me.
Yeah, and I think burnout too, when I had the term resilient put on me, it's like I championed it, but also in coaching, you can use coaching for us or against ourselves. So we are
Mhm.
able to get back up over and over and over again. And where I find it is if we're forcing ourselves back up so many times, that's where that burnout cycle can come, is from my
Mhm.
experience. And also if we're noticing ourselves having to coach ourselves through things, what actually needs to change. So in that, I'd love to hear what your leadership coaching looks like.
Yeah. So I think coaching is really difficult to define. And I think that is part of why you had mentioned earlier, it's kind of like a word that people hear and kind of throw around. And it's very difficult to define what coaching is. But I think what's really important about coaching is that first off, somebody's listening to you very deeply, unlike you've ever been listened to before. And I think that is very valuable just in itself of there's someone there that's not judging you and that's really just there for you and to listen to you and help you achieve your goals. And so I think that's really important to think about coaching in that way of um, this person is literally just there for you and to help you reach your goals and in the way that works best for you. And I think that's really important in that we're not going to tell you what to do and what we think that you should do. It's really about what is best for you and how we can solve your issues or create your goals or achieve your goals in a way that's best for you. And so for leadership coaching, the reason why I decided to become a leadership coach is that kind of all the things that we've talked about so far of what causes burnout, how we're all resilient, that we really need to look at our systems and how they can change for our teams and for our employees. And so to do that, we really need to focus on our leadership team. And our leaders want our teams to be well. Our leaders do not want their employees, their teams to be burnt out. They just don't know how to do that. So they want to be liked, they want to be respected, they want to hear what their employees are saying, but there's a disconnect in that relationship. There's very much right now like like an us versus them, right? In kind of all of our relationships right now that we have. And I think that if we can improve those relationships, we can be heard better, we can change systems, we can do what's right for our teams. And I do think that that starts at that leadership level. And so that is why I've really focused on leadership coaching. There's a lot of people that do coaching for burnout, and I'm so grateful for my coach to help me through that. And I think if we can go to the source, so just like we were talking about before with resiliency, with proactive, right? If we can proactively go to the source and help our leaders more effectively leave and change systems to be better for our teams, for our physicians, for our employees, we really can change the culture and prevent people from getting burnt out. And I think that is really important.
And this is so valuable in thinking back to when I left surgery and I would do FMLA, and then I would come back to the same thing. And
Mhm.
so I'm thinking I was so nervous because when I was doing a lot of therapy at that time, which I think there's a role for therapy and coaching, and you can do them together depending on where you're at and what you need. But I was always so nervous because I would do therapy to get better and then coach myself into going back with the same fears because the things that were making me so anxious, some of it was inside the imposter syndrome, the low confidence, things like I think, oh, what? Should I go back to try surgery now that maybe I can do it now? But I knew I couldn't coach myself out of how I got depressed with my chronic sleep deprivation. So the factors I couldn't change are ultimately what led to me deciding I needed to pivot.
Mhm.
But the beauty of what you're saying is we have a person, they may be individually burnout, they may be working with a one on one coach, but if the things are not improving and then they get better and then they go back into a burnout, a place that cultivates burnout, then they may end up in the very same pattern. And we know like depression and burnout, once you've experienced it, you're more likely to experience it again. So I really love and value the role and what you've mentioned. And if
Mhm.
when we think about leadership coaching, what kind of coaching is that? Like, what's involved with
Yeah. So the way that I do leadership coaching is that it's one on one coaching over a 6-month period to really dive deep into those relationships and what those relationships look like. And I think the other thing to mention as well is that our leaders are getting burnt out,
that?
right? So our leaders want to be helping their teams. And if they're not already in a good place, there is no chance that they can help our teams get into a good place. So I think that's one of the first pieces of leadership coaching is making sure that our leader is in a good place and that they're well so that they can help their teams and their employees be well too. And so starts with one-on-one coaching for 6 months. And then we also offer workshops on different leadership tools. So, difficult, how to have difficult conversations, how to do clear and concise requests, how to plan out your goals, how to review how the year went, all of these kinds of things. We have workshops on each of those. And actually, you can do those separately too. So, I offer that as a consulting side as well. These workshops can be separate from the coaching.
I really appreciate having the opportunity to have a coach involved in those difficult conversations because often we hear people will complain about, this person's so hard to work with. And I threw out the neutral party, the ombudsman, but having somebody that can kind of help cater the leadership role in each individual and then as a group. Do you ever do like trios or something like that as a coach to help mediate?
Have not, but that's a very interesting idea. I like it. Thank you.
I can't take it as my own. My institution is very so. I had reservations about so you're we're here talking from somebody that was a skeptic at first, because I'm like, I don't know, I've been through so much therapy in my life, and this really helped. And then I got into coaching as a person that needed coaching, kind of out of desperation. And then I was like,
Mhm.
wow, this is cool. And then it becomes that thing where people are, even my family was like, oh, that sounds kind of interesting, until they saw the results, and then they're like, what did you do? What juice did you drink? And and I'm like, it's definitely more than that. And I think that my institution is a well-known institution whose the coaching has been integrated within the system here. And there
Mhm.
are when I first got here and I joined the burnout committee, and they're like, what can we do for burnout? I'm like, well, I have a lot of solutions that didn't work. Coaching's the only thing I know so far that seems to be helping people. Can we bring this to the institution? And this is when I was new. And they're like, oh, we already have that in the institution. Here it is. And so the program here is wonderful. And so I've seen from an institutional standpoint the value of what you're offering, which is why I was like, tell me more, what do you do? And because I also know that even within an institution, it can feel nice to also have an outside perspective,
Mhm.
to have that person that just like therapy, it's hard to say things in a sacred space if it's within a
Yeah.
space where you just never know. And is there
Yeah.
any lessons that have personally helped you that you'd like to recommend for people to start with?
I think the very first thing of starting is that self-awareness. I think that's really important, of knowing where you are and what is underneath what's happening for you. I think that is where I would start on my wellness journey, is what is causing these symptoms and what's underneath that. So that way you can figure out what the solution is. So naming it, I think, is number
Naming
one.
it, and we can even start coaching and feeling better today. I think what was
Mhm.
really helpful for me is once I got back to survival, kind of like in that neutral after a lot of therapy, coaching helped me to see what's possible.
Mhm.
And I think that's such a hard transition of unlearning, especially if
Mhm.
you've been in that cycle for a long time. So I really like that you said the self awareness. And then hearing that, I learned I can't keep in this system that's perpetuating the exact issues that I'm trying to heal from. And so if everyone's hearing this and saying, I'd love to hear more from you and I'd love to contact you, where can they find you?
Yeah, so my website is actually my last name. So www.salentinecoachingandconsulting.com. So Salentine is spelled like Valentine, but with an S like Sam at the beginning. So salentinecoachingandconsulting.com.
And how about that Instagram? I really enjoy following you on there. Can we share
And my
your
Instagram. My Instagram, I'm Mallory Salentine, so my name, and then I'm actually posting on LinkedIn as well. So if you're on LinkedIn, check me out there, Mallory Salentine on LinkedIn.
Well, thank you so much for what you do and for joining me today.
Yeah, thank you so much. This was wonderful.
Thanks.